recovery after hip replacement obviously does vary slightly according to age, but rather than age alone, it's more related to the level of activity and the muscle strength of the patient before their operation. Younger or more active patients tend to return to normal function a bit more quickly. And certainly there's evidence to suggest that if patients delay their procedure to the point where their joint is very, very stiff and very restricted in terms of activity, the results post-surgery aren't quite as good as they would have been if they'd had their operation at a point at which their muscles and their joint was a little bit more mobile and the muscles were a little bit stronger. There's some evidence to suggest that the recovery following hip replacement varies according to the type of surgical approach that's used, and the post-operative recovery can vary a little bit depending on whether a cemented or uncemented implant is used. With regard to cemented implants, patients tend to be able to mobilise fully weight-bearing straight away, whilst in the case of uncemented implants, we may choose to suggest to the patient that they protect their weight-bearing with crutches for a few weeks post-operatively. There's a lot of research regarding the different surgical approaches that surgeons may use, and certainly there's a lot on the internet about mini incision approaches, and the anterior approach is one that's had a lot of press coverage recently. There's no evidence to suggest that in the long term the surgical approach changes the outcome of the hip replacement, and overall the results are brilliant. But there is certainly some evidence to suggest that with mini incision approaches, whether it be the mini posterior approach or the anterior approach, that the initial recovery for the patient can be improved. And certainly those patients seem to be able to get mobile a bit more quicker and return to activity more quickly, certainly within the first 6 weeks. So in the very early stages of recovery following hip replacement, whilst in hospital, the nursing staff and physiotherapy staff will help the patient to cope with the immediate requirements of self-care. So the patient will be taught how to get in and out of bed, how to wash themselves, and how to start walking initially with a frame and then crutches. When the patient's confident doing all of these things and being able to climb stairs with the aid of the crutches, then they'll be deemed to be fit to go home. In the early stages of recovery, when the patient's at home, they should think about getting some provision of help with things like shopping, cooking of major meals, and cleaning the house. And certainly for the first week or two, these things are important. As time passes, they'll certainly be able to undertake more of these activities independently. Physiotherapy is vital in getting the patient back to full activity and enabling them to return to full function. A lot of the requirements of physiotherapy depend on the state of the patient before their operation. And certainly if patients have suffered with severe arthritic pain and restriction of movement for a long time, then the muscles get very weakened and the joint becomes very stiff. Following the surgery, it's then a battle for the patient, with the help of the physiotherapist, to regain their normal and optimal muscle strength. And we find that patients that really engage in a physiotherapy program return to normal function more quickly, and certainly in terms of activities such as returning to sport, physiotherapy and maximising the muscle strength is really important in these sort of scenarios. Well, certainly in the early stages of the post-operative recovery, the things that tend to slow patients down are problems such as nausea, drowsiness, and constipation. And these are often associated side effects of some of the painkillers that we use post-operatively. There's always a difficult balance between providing the right amount of pain relief that allows the patients to get mobile and enable them to do their physiotherapy, but without the side effects that we get with those. And certainly modern anaesthetic techniques and some of our modern painkillers, we limit the use of morphine-like drugs, which seem to have more side effects that slow people down. Later on in the recovery, patients suffer with problems as a result of their muscle weakness and stiffness that they developed as part of their arthritic process. And certainly in this sort of scenario, physiotherapy pre-operation can help to improve the range of movement of the joint and maximise that muscle strength, which certainly helps recovery in the early stages. The other thing that we find often slows patients down is lack of confidence, and this is particularly relevant in elderly patients who've had arthritic symptoms for a long period of time. They found their mobility has slowly reduced, and the physiotherapy is really important in these sort of scenarios because not only do they improve their muscle strength, but having that regular feedback and encouragement from the physiotherapist really help them to maximise their function and return to normal as quickly as possible.